Casa Regional Medical Center is a 187-bed nonprofit community hospital. We're proud to serve the communities that we partner with, being Casa Grande, Eloy, Arizona City, Coolidge, Stanfield, and other surrounding areas. We have great staff, volunteers, as well as excellent physician providers who help us achieve high-quality health care. We have committed community members who serve on our hospital board and our foundation board, and they keep us connected to the community.
As a standalone community hospital, we provide comprehensive health care services to our residents. These include emergency and urgent care, home and sleep lab studies, a wound center, and a number of other things including surgical and inpatient care. This means the residents of our community do not have to leave the community to receive top-notch medical care.
Interventional cardiology is a set of procedures to unblock, if you will, the coronary arteries that surround the heart. What we're able to do is go in with a balloon or a stent or several other different devices and open that coronary artery up and establish blood flow to that distribution of the heart. We started an interventional program in October of 2009 after realizing that there was a significant delay in taking care of our patients, getting them transferred out to Chandler or Phoenix or Tucson for interventional procedures. Since starting the program, we've had phenomenal outcomes. Our door-to-balloon times are averaging at 70 minutes currently. The national average is 120 minutes. I can honestly say that there's numerous patients that we've taken care of here at the hospital that simply would not be with us today without the commitment to having an interventional cardiology program and the processes that we put in place at our hospital.
The Wound Center here at Casa Grande treats patients that are suffering from ulcers or wounds. We have a number of different ways to treat those. There are standard treatment options, and then we have here what we call biografting. And what biografting is actually a mesh network that's created and infused with human cells. These are planted into the wounds and then help them heal. The hyperbaric chamber, they deliver oxygen at 100%, which means the whole environment is full of oxygen, and this helps healing too. The patients that come to the Wound Center come because they have wounds that they've had for months and have not healed. These people in particular face the possibility of amputation. I'm thinking particularly of a patient we have right now. He had severe ulcers on his foot and he was facing amputation. We used the biografting and the hyperbaric chambers to help heal his wounds, and now he is officially healed. This man and his success story is just an example of what we do every day at the Wound Center.
Sleep disorders are a bit unlike a toothache or stomach pain. Very often people suffering from various sleep disorders are unaware of them other than feeling excessively sleepy during the daytime. And I'm happy to report that we've recently remodeled the sleep lab and expanded it to 4 rooms. The rooms are outfitted like very comfortable hotel rooms, and we're happy to say that we are performing home sleep studies. Many people are uncomfortable with going to any sleep lab for a sleep study. We therefore have implemented devices which are about the size of a Walkman, and we can perform the sleep studies in the comfort of the patient's home. We've performed thousands of sleep studies over the years. During the evening of the sleep study, it's not uncommon for patients to tell us that with the therapy we've applied that they've had their best night of sleep in years.
Occupational therapy is therapy services designed to improve people's ability for activities of daily living. Physical therapy with pediatrics works on body conditioning for children to be able to gain trunk control, to sit, to crawl, to stand, to walk. For adults and teenagers, physical therapy can work on injuries related to sports or work. The speech-language pathology services offered here range from, once again, pediatrics through adults. We are the only clinic in Pinal County that offers all 3 services. With current Medicare guidelines, they often limit the amount of services a patient can receive in a freestanding clinic. Since we are a hospital-based therapy department, we are not limited by this dollar amount. The therapists are extremely professional. and knowledgeable, as well as very enthusiastic about what we do.
At Casa Grande Regional Medical Center Urgent Care, we provide medical services for things like upper respiratory infections, minor lacerations, coughs, cold, flu, things of that nature.
One situation we had with one of the parents of a 1-year-old came in with spiking temperature of about 102, very concerned. The kid was not taking in any fluids and just vomiting. It was around 8:30 p.m. at night, and the ER waits were really long, 3 to 4 hours, and was not able to get in. So she came in to the urgent care. We checked the patient. The patient did have pneumonia, and we gave her some Tylenol and also hydrated the patient. And the temperature did come down, and the mom was very, very pleased.
We offer our community emergency services 24/7 with qualified doctors and nurses who are very committed to serve our community with excellence.
We recently, about 6 or 7 months ago, launched our Physician First initiative. And basically what that involves is, as much as possible, ensuring that patients are seen by a physician within 30 minutes of their initial arrival. There are several dimensions of the Physician First initiative that improve care. One of them is making sure that whatever the patient's need is initiated early. Another element of the Physician First initiative is the overall length of stay of the patient visit is reduced.
I recently received a letter from a couple who have been coming to Casa Grande for the last 14 years. She said that they've always been concerned about what they're going to do if they had an emergency. Unfortunately, one night this year, her husband did have an emergency. They came to our hospital, and she was so pleased with the service that she now wishes that we were in her hometown in Colorado, our hospital and staff.
The foundation was formed in 2002 as the hospital's window to the community. Through that window, the hospital is able to reach out into the community and find what's needed in the community. At the same token, the community looks back to the hospital and finds out ways in which it can help serve our mission of providing quality health care to the community. Through the foundation, we've been able to establish strong community partnerships with multiple sources in the community. The Stanfield Free Clinic is a great example of partnerships in our community that work through the foundation. First, we were able to secure through a grant that the foundation wrote monies from the Komen Foundation for free mammograms. Those monies, in part, go to the Stanfield Free Clinic that Dr. Liguri created and that Dr. Parkin now runs with the assistance of many other physicians in our community. Also, through the foundation, we get community members involved in the hospital. We've got a great foundation board that gives of their time and talent to this organization. And it's through board service that we develop leaders through the foundation.
We have great staff and volunteers and excellent physician providers that help us deliver high-quality health care. As part of being part of the community hospital, each staff member, physician, as well as board member are ambassadors in the community. It helps keep us connected to the community, and we are proud of all of the community partnerships and appreciate being part of all of the communities that we serve.